right?
Fine.
We'll just do it and we'll cut it. Hey, everybody, I'm Dr. Rimka, and I am super excited. I have Esther Blum with me, and I have to admit, I haven't read your book yet, but I'm going to end up giving some books away when I release this. So when you're watching, make sure you read the caption, look at the little contest, because I'm going to give you some of her books. See you later, ovulator, because the title alone is genius. She goes by Gorgeous Esther on the Instagram, and that's where I started following her after seeing it was Carrie,
Carrie Jones,
the Dutch.
Yes.
Now she's who trained me the Dutch forever, interviewing you. That's how I was like, oh, who is she? And I just love your messaging about aging well, like embracing it, women, I'm 50, and it's like this definite difference and change. And I feel like I'm the best I've ever been, to be honest. I was a little bit nervous about it because it sounds like, oh, wow, that sounds old, right? But I'm like, I feel and function better at 50 than I did at 30, for sure. So there's that. But I do find in practice, I have to fight so much for women as they age to learn to take control of their health, I guess, to be sovereign in their healthcare journey. And I have been stunned for about, maybe 15 or 20 years, finding out, I'm going to say it, how bad OBGYNs are at their job. Like when women tell me, oh, they won't run my hormones or anything. I said, what do you mean? You're having hot flashes, you don't sleep, you're depressed, and you've gained 25 pounds and you're 52. Your gynecologist won't run a hormone panel on your sex hormones. Then what do they do? I kind of looked at it, I go, then what's their job? Isn't that their job? You know what I mean? And it turns out they don't do that. And that's why I can see that women are confused and lost. And I love your messaging. I'm a huge fan of hormone replacement and optimization as well. So I want you to come on here and say anything that you want to tell all the women about your message, your book, and I'll make sure that all your information's in the caption so everybody can follow her. She's good stuff.
Well, first of all, to your point, it's medical negligence at this point, because I'm a freaking integrative dietitian. And guess what? Nobody taught me. I mean, yes, Carrie Jones taught me. I have mentors at the Dutch. I've run probably 1,000 Dutch tests by now.
After graduation is kind of when we learned all this.
Exactly. I worked in hospitals the first 5 years, but I was in cardiology. It wasn't like I was in, functional medicine or hormones when I left the hospital to go into functional medicine. But if I'm a dietitian and I'm publishing 20 pages of studies in the back of my book that I have found, and you are physicians and you are telling me you're too busy, you don't have time, they didn't teach this to you in medical school, shame on you, because that's how I started learning about hormones. I mean, I started treating menopausal women when I was in my 20s. What did I know about menopause? I hadn't lived through it. I hadn't even had a baby yet, right? And so, but women were coming to me and I was like, well, frick, I better help these women and I better fricking figure it out. I mean, the diet part was easy. To me, it was understanding supplements and hormones that began my deep dive and running all of these tests. So if your doctor, I have a lot of reels on, just find a new doctor. One of the top reels that's pinned to my feed is how to find a doctor that will help you with hormones. So let's just start there. Number one.
Because that's what I tell people. They say, what should I ask?
What should I do?
They ask me, like they're either a patient or they're in a course or something like that. And they say, so can you tell me which labs to ask my doctor for? Well, let's start here.
Yes.
If I have to do that for that doctor, you need to run out of the office.
Yes.
Right? Like, honestly, I don't, because they're not going to know, if they don't know how to do that, they're certainly not going to know what to do to balance it, optimize it, help. They're not going to know what to do. So we need to go to somebody that this is what they do day in and day out. And this is their expertise. But you know what I mean? Like, you're going to have to get rid of your $15 copay mentality when it comes to this. That's a big thing I have to explain, right? Unfortunately. Right.
Yes.
So I would love to hear what your advice is. I'm always like, definitely just find a new doctor.
Yes.
Educate the one you have. Yeah.
And understand that the payment you make up front is that short-term investment is going to yield a huge ROI, and where you get on hormones, you balance, and then you're out, and you may have to tweak down the line, but like you can blunt the effects of menopause. I'll talk about the Women's Health Initiative study, how it scared the crap out of women and hormones, but let's just dial in finding a doctor first. So first there's ifm.org. That's the Institute for Functional Medicine.org. You can find, but you've got to do digging and look at, you put in your zip code and you will find a bunch of functional medicine doctors. You've got to make sure they have hormone training, look on their websites, call their offices, say, do you provide bioidentical hormones? Are you open to patches and creams versus pellets? Because pellets to me are the devil incarnate. There's no research studies done on pellets. And some women say,
it's really interesting. I'd like to, because I use pellets, right?
Yes. And
but I'm only testosterone. I'm only testosterone. So it's a little different. And I tell people it's not the optimal. It is my least favorite choice.
Yes.
And
some women need it because they don't respond. They don't respond to
I didn't respond to creams, right? So I do like, it's an interesting thing, kind of the battle. I think this is where people get confused too. So even if they say, now I'm not afraid, I want bioidentical, that's what you have to say. Make sure you're using bioidentical.
Yes. And by the way,
pellets or creams or patches or this, and like, oh my gosh, right? And that's where, God, it unfortunately. And then there's like, battles, but once the pellets are in, you can't get them out. And it can be a rocky ride for 3 or 4 months. So I do agree. It is my favorite form, but I do know people who do very well on them as well.
Exactly. And I do have women in my practice who do very well and swear by them. And then I have other women who just do.
It's horrible. I've seen it too. I mean, because they're very sensitive, and now we can't do anything about it until they dissolve. Yeah,
that's right. So that's right. So you want to go to ifm.org. You can ask your friends. You can find a local compounding pharmacy also and say, what doctors are prescribing hormones through this?
I never thought to tell people to do that. That's a great resource.
Yeah, find a local compounding pharmacy. And by the way, also, if doctors scoff at bioidentical hormones, I can give you a sheet this long of all the bioidentical hormones that are FDA approved that you can get at your pharmacy that are cost effective. If cost is an issue, spend your money finding the right doctor, and you can actually conserve financially on hormones if you need to, if you don't want to go the compounding route. So there's so many different ways to do it. And
compounding isn't even expensive. I think women have a really
have to be.
I think they're afraid of, they think it's going to cost on average. What I've seen in my practice when I refer, and I'm working with several physicians, I run Dutch panels and stuff, but I can't prescribe, right?
Yes.
So I get to a point like, okay, we need to find the partner, and get it. It's 100 to 300 max I've ever seen a month that I've ever seen somebody spend. Like really, like that's the average. Yeah. My sister's a massage therapist who does with an autistic son, does not make a lot of money and has to spend a lot of money on him and his care for the rest of her life. Yeah. And she said, I will never in my life go without this now. It was a total game changer. And she's, everything has to be replaced on it. She's like, it's worth every penny. She's like, this is worth everything. I'm never going to feel that way again. So it's just how it is, a non-negotiable.
Yes. And on the flip side, let's say you're like, no, I don't want to spend a lot of money on hormones. You can get a bottle of Prometrium which is bioidentical progesterone, for $3 a bottle at your pharmacy. So whatever you decide. So you talk about those options with your doctor, right? You talk about your budget, you talk about your goals, your outcomes, and then you try, because there isn't always one direct path. It's rare that a woman starts on hormones and stays on that same dose, especially if she starts during perimenopause, which, by the way, is the best time to start introducing hormones, so that I say you smooth out the bumps, like you make the transition so much easier. Even if you're on the pill, even if you're on an IUD, you can start bringing in progesterone. If you're in late perimenopause, that second half of the cycle, the luteal phase, can be transformative, can offset your depression, your anxiety, your insomnia, and the crime scene periods, all of it. It's like the simplest, gentlest route. It's so safe.
Yeah,
so
it's so safe. Progesterone is so safe. When I hear someone, I'm like, Do you guys not understand what this is? And it's the happy, it's like, if you understood what progesterone did to your mood and your fabulousness, you're like, that's why some women are just like, that was the game changer, because they make,
Yes.
you know, how they have the pathway in the brain, and it's so much GABA production. It feels so good
Yeah.
in the sleep, and they just don't understand. I'm like, well, let's just try a topical cream over the, like, this is not, we don't need a prescription, and you can just eat. Does that help? And you're like, oh yeah, well, there you go. Now, eventually, if they have to go with like, you know, a clean oral or something, fine, as you get older or whatever. But if you work with, like you said, a good physician that knows what they're doing, this really is an art. Hormones are an art, because as you're aging and changing, right? I mean, I still ovulate, right? I'm different every week. Every week I'm different, and I'm 50. So like, it's really in that, you know, perimenopausal changing.
Yeah.
Kind of forget that, like, nothing's wrong with you, but we just have different spikes and surges. We're just a little bit more sensitive right now, as the ovaries are like, pumpkin, I'm getting a little tired. I only have so many more eggs and so many more things, you know,
That's
the
right.
adrenals have to pick up and stuff. That it is an art. And I want them to know that when you're working with a physician, it isn't going to be the same. And please don't think often that they screwed up. Oh, I had a bad, it's okay. You need probably to get your labs done again, and they have to look at what's happening, because it is going to change. And I have to remind them of that. No different than a thyroid. I'm like, you shouldn't, if you're taking a thyroid
Yes.
replacement, you should be getting tested minimum every 6 months. I'll have people say, oh, I haven't had labs in 4 years. I said, you haven't had what? You've been taking the same
Yeah.
hormone level. You should be getting this done at least, I like every 3 months, but okay.
Exactly.
You know what I mean? So
yes.
any hormone and replacement modulation, if you start sleeping better, losing weight, getting more sun, eating different, you could improve your own production. Therefore, your replacement needs to change, right?
That's
So
right.
it's an art form. Yeah.
Yes. And you can never out hormone your lifestyle choices. Like, don't think that taking some progesterone 2 weeks out of the month is going to be transformative if you're drinking alcohol every night and like not managing your stress and not getting outside and not working out. I mean, obviously it's a piece of the pie. It's not the whole pie.
Right.
And I do, you know, chapter 2 in my book, I go over all the testing and the hormones, but yes, you should be followed up, especially like within 6 to 8 weeks of starting. You should follow, because a lot of women experience side effects, right? You can, a side effect of starting hormones is you can gain, you know, 1 to 3 pounds of water weight those first few months. You can have breast tenderness, you can have different cycles or moodiness or irritability. So you do need to check. And then if you're menopausal, you want to make sure you're checking to get your blood levels up to a certain amount to maintain your bone density and offset the risk of Alzheimer's and heart disease. So yes, your tissues do take, you know, 3 to really 6 months to fully saturate with hormones. And you do need, it is bumpy at first. I'd be lying. I mean, the first 3 months I went on progesterone, I looked like Dolly Parton, like my boobs just totally swelled up. I was like, ow, and they really hurt. And it felt like I was pregnant again. I was like, ow. And then boom, I just like leveled up my detox in my liver. I put myself on protocols. I put my own people on, and it was like, boom, it cleaned it all up. So
I think it's nice you said that we're, you know, understanding a little bit of stuff doesn't mean necessarily it's a negative thing. It's as you're getting used to it, which again, to me is more reason to start it earlier. Like, as it starts, many of you women, they're in their 40s. I have some women now who are like 43 and they're full menopause. I'm like, they haven't had, you know what I mean? I'm like, wow, okay, this is where we're at, you know? And so why wouldn't you do it then? Why are you waiting? Because you hit it. Bone density is a massive issue with losing these hormones. Let's not even talk about collagen and beauty in your skin and your wrinkles, which women care about. I'd much rather you have hormone replacement than going in and Botoxing and filling and surgery, right? This is a way to do that. You know, brain health, mental health, mood, it's unbelievable the impact this has. You know, like I've seen women, once they start doing it, they're like, oh my God, usually it's, I just feel like myself again.
Yes.
I really feel like myself.
I have cognitive function. I can find my words again. I walk into a room and know what I walked in there for, versus having this real brain fog and these irritability and mood swings. And I mean,
they're having dementia symptoms or ADHD. I've seen it misdiagnosed so many times. I go, what? I go, no, you don't need neurofeedback. You know, like, it's not attention deficit. It's not anxiety. it's because, well, you're feeling that, but it's from this. So this is the real treatment you need, right?
Yes.
So, you know what I mean? That's the cause. So let's, why don't we do that versus me trying, I mean, you know what I mean? So I think it's really nice you said, because women need to kind of know that, like, hey, it's going to be a little bit different, which again, more reason to me to start early, and it's much easier and smoother the younger you are.
The younger
You know?
you are. And the other thing, you know, that women are really shortchanged on is their doctors are only prescribing estrogen and progesterone. No one's talking about vaginal hormones and no one's talking about testosterone. And I'm like, ladies, what do you think is going to contribute to your cognitive function, your ability to really keep those synapses firing?
Testosterone's the jam. I talk about it all the time. And what I find is what's fascinating, the only ones who talk about that I've found so far, they're the male gynecologists. Because again, because they're thinking about testosterone. So the first thing they go, oh, it's probably testosterone. It was a man on the phone with me that said, it's testosterone, Stephanie. That's what you need. You don't need growth hormone. I'm like, are you sure? He's like, let me run a lab. I guarantee, I'm almost positive it's going to be your testosterone. I'm like, oh. Yeah. And so it's men are the ones that I've found. And it's interesting because a lot of women don't want to see a male gynecologist, right? Like, I don't want to see a man. And I'm like, I'm not saying you have to. I'm just telling you, in my experience, they're the ones that understand testosterone and are like, you probably, they know to test for it, they know to look for it, they understand total gluten free and what to do. And many of the women just haven't come along to that yet.
That's right. And it's not FDA approved for women. It's still considered off-label use, which is not helping our cause at all. I'm like, oh my God. Like, to me, you know, I started hormones in perimenopause, and when I added it, I started estrogen and progesterone and was using vaginal estrogen, which all of that was like, oh my God, so awesome. But then when I add in testosterone, I was like, oh yeah, that just left. I was like 85%. And that just immediately, I just felt so much better cognitively and energetically. My energy.
Testosterone is confidence and swagger. I mean, when I tell you, women who are like, how do you do that? I'm like, it's swag. It's you're just low. You know what I mean?
Yes.
So let's talk about the vaginal estrogen. Like, when does a woman know she would need that, or to bring that up? Because
well, so, and vaginal estrogen,
I know so many women who now they love their husbands and none of them are having sex anymore. And that's
right.
I actually asked the question. Like, so people, it's mental health. And I look at their faces, like, it's always a shock that I'm asking if they're having intercourse. Like, so you're having sex? How often? When was the last time? And it's like I don't know, 2 years ago, or I'm like, okay.
And can you even achieve an orgasm? Or like, does it take
like,
an hour?
But it hurts. And it's like, oh, okay. You know, and their husbands are like, okay, you can help with that? Because they miss their wives. They miss, you know, the sexual energy, and so do the women. But like, I want to, but I don't want to anymore. I love him, but like suddenly, right? And I think it's just they're missing. I'm like, oh no, this is unacceptable. This is an important part of who you are and your relationship. So
that's right.
Let's talk about that a little bit.
If you follow the work of Dr. Rachel Rubin, she's a urologist in Maryland. You know, she says every woman over the age of 45 should go on vaginal estrogen. You know,
so why is that? Because I'm not on it. So I'm like curious. Tell me why I should do it, or what. I don't feel like I need it. So maybe I do.
That's right. And not all women are dry or experience dryness or painful sex, but again, it's prevention. It's maintenance of the collagen and elastin in the vaginal wall so that you don't have atrophy, you don't have bladder prolapse, you don't get UTIs. And
so what if your estrogen's even okay on a blood, like my estrogen's?
Yes.
Still use a little bit of it?
You can still use a little bit of it and it also prevents clitoral atrophy, by the way, which is a big one. So you want to use it more prevention. You really only have to use it twice a week. And it's a microdose. Like the Framingham nurses study looked at women using vaginal estrogen for 18 years. Again, these are microdoses, and there is no increase in circulating blood levels of estrogen at all. It's safe to use even if you have had a history of cancer. It's safe to use even if you don't have a uterus. Like, it's ridiculously safe. And so it's really about prevention, because once you start losing the collagen and elastin, that's when you really have a lot of problems and pain and lack of lubrication.
Yeah.
And again, that clitoral atrophy is very real. Like you can put vaginal estrogen on the clitoris, you can put it on the vulvar area. You can use it externally and internally. Okay. So it's really, really helpful. And if you, let's say you still are like, no freaking way would I use estrogen, you can use vaginal DHEA also. Now, the difference is with vaginal estrogen, you use it 2 weeks straight and then twice a week thereafter. With DHEA, you have to use it for 12 weeks straight and then twice a week thereafter. And but it has the same results as the vaginal DHEA. And then if you still don't want to do it, there are laser treatments that you can use also. The way, we restore collagen and elastin to our faces with laser treatments, you can do that vaginally too. And again, I put this all in the book. So
and is the extreme of that these vaginal rejuvenation surgeries that you see?
Not a surgery, just a wand.
No, but that's a thing, right?
Oh yeah.
Yeah, I was like, sure. What do you mean? What do you do?
But the surgery does it, right? It may improve structural integrity. But like one of my friends joked, she was like, when I have sex with my husband, it's like throwing a hot dog down a hallway. Like, it's just like everything was so loose and open. So yes, a surgery can tighten things up, but it won't produce hydration and lubrication. So you still have to have something up there to really get the lubrication.
Okay. I love that you said, because not people don't think about the vagina and collagen, they're like, yes. Oh, right. It needs to be, yeah.
My God.
Okay,
and when
awesome. That's a new thing. I'm going to talk to my person and be like,
yes. And when those walls get paper thin, you damn well better believe you're not going to have sex. It's going to hurt. You're going to have micro tears. You're going to, it's really, really painful. And no amount of masturbating is going to bring that. It will help. I mean, masturbation and sex, it's like Kegels for the, right. Yeah. It's like a facelift for the vaginal walls. But again, you still have to get the lubrication in there, or you're not even going to want to masturbate. It's just everything's going to hurt. Okay. So you want to make sure. But in terms of clitoral atrophy, one thing masturbation or vibrators is good for is really, sometimes women require a lot more stimulation later on when estrogen levels are low. Until you've brought your levels back up, you may require, a higher level of stimulation and for longer. And so if you don't want your partner to get carpal tunnel in the process, then yes, you can bring in sex toys, you can bring in a vibrator and get the stimulation going.
They have some really interesting one. I've been looking at them for the pelvic floor dysfunction in my older ladies, like 70 and stuff like that. Like, I don't know if you mystery vibe. I really I can't believe I'm like reviewing. I looked at them, I'm like, wait, these look like sex toys actually.
Yes.
But they are strengthening, right? So they're like internal things and vibrators, and they have ways from him and her. And I'm like, fascinating. And I can't believe in my appointments, I'm like, so here you go. I'm like, yes, don't think of it as a sex toy. I'm like, why don't you guys try this? Why don't you, to help, just like you said, and a lot of it is about the floor and helping her, do that, but then I didn't think of it that way. Yeah. The clitoris is a whole special organ most women don't even understand. When you try to explain to somebody, like I'm kind of going down that route of sexual health more in my career now, which it seems odd, but it's not. Then I'm like, oh,
yes.
Well, and health and healing, right? Because if we have an organ that all it does is provide an explosion of healing. An orgasm is an explosion of healing, is what it really is. And we have the clitoris, that's all it does. Literally, that's its job. Men don't have that. There's no male counterpart because they got to pee with it and make a baby with it. Not us. It's a whole separate organ, 6,000 nerve endings, and very long route into the vagina that people don't really understand what that is.
That's right. I know. It looks like people who are listening, like it looks like a wishbone almost. Like it goes.
It's very big. It's got antenna. It's got it goes really deep up into you.
Yeah.
Yeah.
It's really wild. It's so cool. And that's the other thing too, is if your pelvic floor is too weak to have an orgasm, you also need to get your pelvic floor checked out and get some pelvic floor PT. And I call mine my vagician. And
I love that. There are people, that's what they do. So I want women to know that, they've had a few babies and C-sections, and now they're kind of accidentally peeing on themselves and other things. Like, no. you can get help. There are very good physical therapists, and there's even biofeedback. There's a whole specialty. I'm a biofeedback therapist, and I was like, wow, with using that's their whole specialty. Like, there really is a lot of help for this, but your physician might not be telling you because they don't know about it.
That's right. That's another area where I feel like GYNs failed. Like I too needed to loosen my pelvic floor. Like, I'm such a clincher, right? And I kept saying to my doctor, I'm peeing all the time. I have this nocturia. Like, I was up like 7 times a night and so tired all the time. And my GYN never said anything. And it was because I talked to a girlfriend who was like, wow, I'm having vulvodynia and I have pelvic floor dysfunction. I was like, what? Let me go to that person. And I went to her urologist and he was like, oh my God, yeah, you're hypertonic. Go get some pelvic floor PT. And like, people don't realize pelvic floor PT, it's not only loosening up the trigger points internally, but it's also strengthening your glutes. It's doing your deadlifts. It's doing your hip bridges. And really, like, there's a lot of exercises internally, externally. So, we really don't understand. I didn't understand all the biomechanics of a pelvic floor until I was like, what even is a pelvic floor? It's all right. The muscles basically between the hips, right? Like under the bladder and that are supportive.
And we need to pay attention to it. Like, it's one of those things we don't think about.
Yeah.
And my mother is 78, I think, something like that. And like last year, the year before, the thing started falling out of, I'm like, and so I'm getting the phone calls. I said, wait, what's happening? I'm like, it's prolapsing. I'm like, oh God. Like, even though you study it in a book way back when, to know my own mother, I'm like, oh gosh, this is actually real life. Like, things fall out of you. I'm like, I'm not trying to have that happen. I'm going like, you know what I mean? And the time to get on things is now versus 75, right? And it's really about prevention and having a different understanding. And I'm like, I don't want surgery to pull my stuff and staple it to I'm like, they're going to do what to you?
Right.
Okay, which needed to be done because you were suffering, but I'd rather work my best to prevent. That's a great tip too. And I bet insurance, therefore, because it was a referral inside your medical system.
It covered a good chunk of it. And then also vaginal, and then it calmed everything down. And then vaginal estrogen is also an important part of treating the incontinence too. So it's all of that.
Beautiful. Mm-hmm. Why don't you talk about why women, it's interesting when you said like, well, if they're going to not use estrogen, no matter what, you could use DHA. I'm like, let's talk about why there's such a fear. Hormone replacement. Why do they think estrogen is the devil? Why do they think to stop? You know what I mean? Like, let's talk about this.
So that damn Women's Health Initiative study that came out in, 2001, 2002, came out. This was this study designed, and it was a huge study. I mean, 27,000 women were enrolled in the study, which is really one of the largest studies to date. And they gave women, I don't know what schmuck designed this study, but women 10 years post-menopause were the starting point. So already have an increased risk of cardiovascular disease, Alzheimer's, stroke, 10 years out. Were given synthetic estrogen derived from the urine of pregnant horses, which is Premarin.
Synthetic from a horse.
Synthetic, not bioidentical, and given no opposing progesterone. Nature doesn't make hormones as soloists.
Everything has a coupled pair. Everything's a coupled calcium, magnesium, sodium, potassium. I'm like, thyroid, adrenals. They need to stop thinking there's one thing. It's always a system.
Yes, and antagonistically and balanced. And so you don't give progesterone without estrogen and or testosterone. And so these women were put on it and the data was analyzed, and the researchers are like, oh my God, it increases risk of heart attack and stroke. The increased risk it went up from 4 people out of every 10,000 to 5 people out of every 10,000. Right. That is not statistically.
It's not. So even using the worst, the fake synthetic where we know we have problems, not balancing it and picking people who are already sick, basically, that's the only increase. And they've made it so inflammatory as if it's like a massive thing.
And if you look at the pamphlets, if you Google the drug label for hormones, those warnings that it increases your risk of cancer, heart disease, and blood clots is still on the label. The pamphlets haven't changed in doctors' offices. So all of that was debunked in 2018. The North American Menopause Society put up a new position paper and was like, oh, by the way, no, we looked at the data. It's not statistically significant. This was a poorly designed study. Hormones are safe, effective, minimum use of 10 years, better with early intervention versus waiting. But even, and I get so many DMs on this, like, what about the risk of blood clots? I'm like, talk to your doctor, because I'm not a doctor and I'm not your doctor.
I don't know why it's not true.
It's been debunked. And
it is debunked. I mean, I kind of go with like, but that's not true. So it's been debunked. It's like the same as cholesterol and heart disease. I can't stop them from repeating the same nonsense that isn't true.
That's right.
Like, you had a higher risk of a blood clot on the birth control pill, and none of you seem to really care about that.
That's right. And that's the other thing, is that bioidentical hormones are given at a fifth of the dose of birth control pills. And by the way,
what a great factoid.
Can we look at your other lifestyle factors? Like, are you exercising? Are you controlling your cortisol? Are you controlling your weight? Are you watching your refined sugar intake? Are you smoking? What's your alcohol intake like? Like, look at your sleep and stress, look at your joy in your life, and look at all those other factors. And then, it's right. Like, stress is far more pro-inflammatory than some estrogen, bioidentical estrogen.
I like that. You feel like it's 1/5 of the birth control pill, and people are putting 12-year-old daughters on that like it's nothing, destroying their mental. I can't stand birth control pills. I think it's one of the worst abominations that on women's health that's ever been done, actually.
Yes, and yet, I mean, if you look at the politics and abortion, it's like, it's a real,
I get it.
motive.
It's a tricky situation. I mean, I've had parents say, yeah, but look at her. She's 14. She's been drinking and doing crazy things. I don't need her to be pregnant.
I know.
It's kind of like, I know, but it's not helping the mental health problems. This is causing the mental health problems in these girls.
It's a real conundrum.
Yeah, it is. It's a tough one, but I'm letting people know, as far as health, it's horrific.
It's horrific. I know. Barrier methods, condoms all the way, ladies. Or I can't wait till boys have birth control, but God knows if they'll use it. So I don't know. But yeah, so hormones are safe and effective. People should not be scared of them. And I've had women more than 10 years out of menopause go on hormones. And I've had women I've treated in my practice in their 70s. And when they stop, and they've been on hormones already 20 years. And when they stop, the hot flashes immediately come back, and the skin sags and wrinkles and all the symptoms come up. So it's like, there's no study yet to say it's safe and effective for long-term use, but there's absolutely possibility in the studies where they're saying it may be safe for long-term use.
Yeah.
Like, I can just look at the women in my practice and be like, they're thriving, they're awesome. And these are women who are smart and successful and in their power and all the good things. I never want to stop hormones.
I would never either. That's my basic suggestion when people say like, say if they're 70 and it's like, well, is it too late? Well, obviously we can't go back and stop what happened, but I think I would go on it? Like, I would absolutely, like, you should look into it. I don't think it's too late, because again, bone density, cognition, memory, mood, libido. I mean, like, I think you should still be living life. And hormones are life force vitality. And I'm of the position, I get where people say, shouldn't we just age and let it happen if it's supposed to happen? There's actually some controversy if menopause is actually natural or not, because if you look at some tribal cultures, these women aren't doing what we're doing. They're getting pregnant a whole lot later in life than we are. They're living longer. It isn't the same. So I really think, just like we're in a testosterone crisis with men, and we look at the numbers and say, whoa, 20-year-olds today have the testosterone levels of 60-year-olds 20 years. Like, this is a serious problem. I think hormones are being depleted across the board, and they're being artificially lowered and lowered sooner than they would be if we lived in connection and like in a more natural state. We live in cities, we wear plastic. I mean, our clothing is plastic, our cars are plastic, we're drinking chemicals, endocrine disruptors, we're poisoned by light, we don't exercise, you know what I mean? I'm like, this is not natural. I don't think it's natural for these levels to drop. We base that information off running labs on a bunch of civilized, citified, sick people, basically. I'm not sure that's a real good bar of what's optimal, right?
That's right. Normal in this country is Homer Simpson. That doesn't mean it's optimal. And the lab values have not been updated in over 100 years. It's like, that was then, this is now. And like we do need to change and really make those standards much tighter. I mean, I look at, if you look at insulin level, like the range, the quote unquote normal range for insulin is up to 18. I'm like, everyone's insulin needs to be 5 or under.
Yeah, under 2 to 5. You know what I mean?
2 to 5, not up to 18.
That's I'm like, what I tell them. Like, you guys, their numbers they're trying to kill you with these numbers. They don't understand. But if you're at 15, you have a serious problem.
Yeah. And you better get on, at this point, go on medication in addition to nutrients until you've gotten your lifestyle dialed in, or in couple with, I'm like, at this point, bring in metformin, bring in something. I do this. I tell people too, I'm like, hey, we got to leverage metformin, we will, because this is a serious problem and this is devastating you. And then let's go and then we back it off. That's what I like to do. Yes, too. I know. This is why I love you. Like, all of your posts too are so spot on. When you talked about like the wearable technology, I was like, thank you. Like, it's a struggle. That is disruptive. That is
so disruptive. I actually had to do a sleep study on myself last night. I've got to do it for a few days to deal with my teeth stuff. So like, okay, I didn't sleep 1 second, I swear, because I had that stupid thing on, flashing lights on me all night.
Oh my gosh.
I'm like, I think this thing is ruining my sleep. Like,
my how ironic.
There's this dumb thing doing it, right? But that's what people don't think. They think all this stuff is benign. It's not.
It's not.
And so just you and I sitting in front of a computer right now, we're depleting our hormones.
I know.
Artificially. And we're doing it so we can teach and educate and help people and make a living. And it says, I get it. I like my house. I don't really want to live with the cockroaches on the ground in Costa Rica either. You know what I mean? But there's a balance. So I have to do things to artificially bring nature into my life. That's why I have red panels. That's why I have a sauna. That's why I cold plunge. That's why I do some peptides and stuff, because I'm combating how ridiculous I live, that I get on airplanes and fly up really high into the sky. That's not normal. You guys understand? I really shouldn't be up that high with that much radiation hitting me. You pay a price for that.
That's right.
The physiological, biological price. Right. And so I think the hormones take the hit. And I think that's the justification of replacement is, you should be replacing at this point because of the way modern technology and life is depleting this. So just like you must exercise in a gym, if you lived with nature, you would never have to do that, right? Because your life would cause, building of the muscle, right? Because you would do hard work. We don't do hard work anymore. So we have to join a gym, right?
Yeah.
If your hormones from all the way you're being poisoned and anything else and lifestyle issues, just look at even diet, 20, 30 years of low fat eating.
Oh, I know.
Low calorie. What did that do to women's hormones? That's why everybody has a thyroid problem and why everybody has low everything. We devastated ourselves with some really information.
Yes, right? Yes. But I'm glad you touched on diet real quick, because diet also is something that's so empowering, that you can have so much control over your menopause and not gain weight and still fit into your clothes. And yes, I mean, your body, my waistline is definitely thicker, but I still fit in all my clothes and still wear a bikini. And, so it's
a softness that I actually kind of like. It's a dip. Like, I gained a little weight and I brought it back. I was like, okay, there's a little thing, but there's actually more of a feminine, softness about it that I really embrace. So talk a little bit about some of the top big advice on the diet for women going through this.
Big advice on the diet. I have 3 mental laws for fat loss, and this is also in See You Later Ovulator. So the first is, you want to make sure that you're really optimizing your protein. And protein, people think, 60 to 70 grams is enough. That's really, I always like roast my clients and I'm like, you have the protein intake of a dialysis patient. Congratulations. And they're like, what are you talking about?
Yeah.
I'm like, honestly, like they'll have, avocado toast for breakfast because that's healthy, quote unquote. And then, or oats. Oh my God, don't get me started.
Oatmeal, don't get me started.
Don't get me started on
the
oatmeal.
worst thing on earth, right?
Oh.
Get all oat milk.
Oh, oat milk is the worst. Don't buy into it, people. It's like greenwashing.
Like a glyphosate poison. It's just like literally, why don't you just drink Roundup?
Why don't you just drink Roundup? Nice little Roundup cocktail. Yeah, with some olives.
Anyway, okay, so protein.
So yeah, and they'll have, or they'll have one egg at breakfast and then, a little more at lunch, and dinner is usually a proper meal. So we really have to start optimizing protein. It's gonna boost your dopamine and serotonin. It's gonna prevent cravings and that dreaded 3 p.m. crash when normally you're reaching for caffeine and chocolate and stimulants. It's gonna optimize your sleep, but most importantly, it's gonna optimize your body composition. So really, 100 grams a day is the minimum. I really try and get women anywhere from 120 to 150 is really a goal. Not everyone reaches it. Not everyone reaches it every day. But if you can there were studies done on Navy SEALs and, for 4 days of rigorous workouts, very low calorie. And as long as they maintained 100 grams of protein a day, they did not lose lean muscle mass. Now, these are men, not women. I get it. But the premise is, minimum of 100 grams of protein a day ideally from animals. If you're going to have plant protein, 100 grams a day, your carbs are going to really tip the scales.
Yeah, and it's really not enough because they're not getting enough leucine.
They're not getting enough leucine. That's right, which you need to build muscle.
And the carbs go up and the calories go up, really.
Yes. You would have to eat 2 cups of quinoa to get the same protein in a 4-ounce chicken breast, and you'll have a lot more calories and even
and for those who are watching, you guys, 4 ounces is like not even my palm. It's a very small amount of meat. When the women say, I don't know, I'm having trouble getting all the protein, I'm like, why? I still am very confused on this, Esther. I don't know if you.
Yeah, well, a lot of women.
Not a lot of food, actually.
Women aren't moving enough to stimulate appetite. And when you're lifting weights, you're going to stimulate your appetite better. And they're also low HCl, low digestive fire. And so a lot of women aren't digesting meat well or feeling really bloated or really full. So it's, that's why I work on gut health with hormones. But anyway, and the Meno law number 2, track your food for 3 days on any app and make sure that your protein is higher than your carbs. So if you're getting 100 grams of protein, get 80 grams of carbs or 90 grams of carbs. Just regulate your insulin, or ideally 120 grams of protein and 100 grams of carbs. Just
a really easy, simple thing. In any diet,
simple.
You know what I'm saying, for people, doesn't matter what you're doing, paleo, carnivore, whatever. That's a really simple, easy. I like that.
Simple, easy. And the third is eat carbs at night, because that little bump in insulin you get from your sweet potatoes or your rice or your legumes, if you tolerate legumes or quinoa, pair it with a protein and a fibrous veg, but then have some carbs at night, again, because that little spike in insulin will tamp down your cortisol and help with that menopause related insomnia too. And it helps with anxiety and it helps with satiety. And it just, if you're going to have carbs, you don't have to, but if you're going to have a starch, it's
well,
really
here's the thing, in
dinner.
the satiety studies, when I tell people, I'm a carnivore, but I don't make everybody do all that, right? But it's when you look at sensory specific satiety, not eating a lot of stuff, so you eat one thing and you eat less food, that potatoes are the most satiating food, and then red meat. Yes. And then fish. It's really interesting. So I'm like, so they go, so you're saying I could have like a potato for dinner? I'm like, yeah, actually, if it works for, you know what I mean? Like, yes, like, so yes. I don't want them to be dogmatic on a diet either, unless I'm dealing with Crohn's or something, or all kinds of crazy reactions. Yes. And even then I want it healed. I don't like the answer to be, you can't eat food.
Right.
You know what I mean?
Or like, carbs for women.
Anything. I just don't do it because I am lazy. And I'm like, I'm like, it's just so easy to eat it. But if I want to have a potato, I'll eat it. Right.
Exactly.
So, and I really like that. And so like really a steak, there's a reason steak and potatoes were like the American, standard, everybody steak and eggs and steak and potatoes. Yeah. And everybody was satisfied and lean. Not physical movement. You're right.
That's right. Because
I like that point about
anyone can snort a line of chocolate chips, but no one's binging out on half a cow. Like your satiety centers will shut down.
Yeah. Yeah.
So speaking of shutting down.
Yes, I know. We got to go.
We got to wrap this up.
I'll make sure it's all in the caption. Best places to reach you.
Yes.
You.
Gorgeous Esther on Instagram. Get on my list at estherblum.com. And if you want my happy hormone cocktail, go to estherblum.com/cocktail.
Awesome. We'll have everything in there in the caption, you guys. And I'm going to come up with some type of little contest and give away your book. I'll buy some books and send it out. I'm super excited to read it. I'm I go, oh man, how we are learning though. We have so many books, like a stack. It's like mental what I'm trying to get through right now. Are you on Audible?
No, I'm not on Audible. This one's visual because it's weird to like sit and read out supplements.
I know. I just didn't know. Science is hard to hear, but for me, sometimes that's the best way I can get it done.
Yes. No, it's a consideration.
Yeah, it's because this isn't my expertise, but I have so many women in this position and I'm having to learn more and more. And then I work with people like you who really take this on. And I'm like, okay, I do my little part until I kind of refer them out and help them find, and I handle this part and then that person handles that part and we work together. So I really appreciate what you're doing to educate women and so they can be empowered to make good decisions, because there's too much gaslighting in the healthcare system to begin with. And I think women in particular take a lot of it, and it's time for that to stop. And they need to have information and say, no, that's not what we're doing today. So watch your, reels, and it is really very cute. I love how you have a very fun way of poking fun as well. So you do a great job. Have a beautiful rest of the day. Thanch you so much.
Thank you so much. We'll be in touch.
All right. Okay,
Take care. Bye.